that all the newly added confirmed cases are highly relevant to the Xinfadi wholesale market. However, we are not sure about the mutation of the virus. Currently, the epidemic is still spreading across the capital city, and we have to stay vigilant. We have to be aware of the long-term effort's importance, and we should never lower the bar and believe that we could lower our guard against the epidemic. We should always stay vigilant against the COVID-19. This epidemic has caught everyone by surprise. Immediately, the municipality of Beijing has taken prompt measures to guard people's safety and health, and also to avoid the further spread of the epidemic. After the outbreak, the municipal government of Beijing has taken measures to shut down immediately the wholesale market of Xinfadi, and also taken lockdown measures for the surrounding areas. Today, for the Yuquandong market as well as the other surrounding areas, we have taken lockdown measures. We have distributed the responsibility to the local districts. We hope that all the residents could respect the rules and they will not believe the rumors and spread the rumors. Please always refer to the authorities and the official account for the correct information. Please wear correctly your masks. Please avoid excessive gathering of the people, and please pay attention to the food safety. Today we have invited representatives from multiple authorities from Beijing to give us information about the prevention and control measures. And first of all, I'd like to introduce to you all the spokespersons. First of all, the Community Response Team member of Beijing Leading Group for COVID-19 Response, Counselor of the Organizational Department of Beijing Municipal Party Committee, Xu Ying, Level 2 Counselor of Beijing Trade Bureau, Wang Hongcun, and Deputy DG of the Beijing CDC, Pang Xinhuo. First of all, I'd like to give the floor to Deputy DG of Beijing CDC, Madam Pang Xinhuo, to give us the latest update about the COVID-19 in Beijing. Good afternoon, friends of the media. Now I'd like to talk about the relevant information about newly added confirmed cases on the 14th of June. From 0 to 24 o'clock, there are 36 newly added confirmed cases in Beijing, among which 25 male cases and 11 female cases. 2 of the cases are from Beijing and 34 cases are registered in other provinces. 2 in Daxing, 2 in Dongcheng, 1 in Chaoyang, 1 in Shijingshan, 1 in Fengshan, and the rest of them in Fengtai. We have completed epidemiological survey for 34 cases. Of them, they are all related to the Xinfadi market. The rest 2 cases are still in the process of the epidemiological survey. Case 1, male, 43 years old, from Hebei. He is living in the residence of the Xinfadi market. He is a worker of the market. He is tested positive for the nucleic acid test. Combined with its test, for example, the routine blood test, he is the confirmed case with light symptoms. Case 2, male, 29 years old, from Hebei. He's working in the Xinfadi wholesale market. He's living in the residence for Xinfadi workers. He found that himself had symptoms like the burning throat on the 10th of June. He is tested positive in the nucleic acid test. Combined with the epidemiological survey and the other test proofs, he is confirmed as a COVID patient and he has mild symptoms. Case 3, male, he is living in Nanyuan Street. He has visited the market for shopping. On the 9th, he started to have the symptoms, and then he visited the fever clinic in the hospital, and then he's tested positive. According to the other clinical test results, he's confirmed as COVID-19 patient. He is classified as a general case. Number 4, male, 44 years old, from Henan. He's living in Huaxiang in Fengtai District. Every day he visited the wholesale market of Xinfadi. On the 13th, he visited the fever clinic of Fengtai District. Combined with the other clinical tests, he is confirmed as a COVID-19 patient, and he's tested positive for the nucleic acid test. Number 5, female, 64 years old. She's living in the Tiangongyuan Street. On the 5th of June, she's visited the Xinfadi market, and then she developed the symptoms, and she's tested positive for the nucleic acid test. Combined with the other clinical test results, she's diagnosed as a confirmed case, classified as general case. Number 6, 64 years old, from Hebei. He's working in Xinfadi market. He's living in the Huaxiang of Fengtai District. He developed the symptoms since the 9th of June. For example, the uncomfortable situation with the lungs. He's tested positive for the nucleic acid test. Combined with the epidemiological survey and the other clinical tests result, he is diagnosed as a confirmed case, classified to the general case. Number 7, female, from Hubei. She worked for the Xinfadi market and lived in the residence of Xinfadi. She developed symptoms, and she's tested positive for the nucleic acid test. Combined with the epidemiological survey and the other clinical test results, she is diagnosed as a confirmed case and classified as a mild case. Number 8, male, 47 years old, from Hebei. He worked for the market and he lived in the residence for the Xinfadi market. He's tested positive for nucleic acid test. On the 13th of June, he developed further symptoms. Combined with the epidemiological survey and the other clinical test results, he's diagnosed as a confirmed case, classified as a general case. Number 9, male, 50 years old, from Hebei. He works for the Xinfadi market. He lives in Huaxiang in Fengtai District. On the 9th of June, he had a burning throat. In the sampling test, he is tested positive in the nucleic acid test. Combined with his epidemiological test and the other clinical test results, he is diagnosed as a confirmed case for COVID-19, classified as a general case. Number 10, 43 years old, a female. She works for the Xinfadi market, and she lived in the Xihongmen. She's been tested positive in the nucleic acid test. Combined with her epidemiological survey and the other clinical test results, she's been diagnosed as a confirmed case, classified as a general case. Number 11, male, 28 years old, from Hebei. He worked for Xinfadi market. He lives in the Xinfadi workers' residence. He is being tested positive in the nucleic acid test. Combined with his epidemiological survey and the other clinical tests result, he's been diagnosed as a confirmed case, classified as a general case. Number 12, female, 48 years old, from Hebei. She worked for the Xinfadi wholesale market, and she lived in the Xinfadi workers' residence. In our sampling test, she's been tested positive in the nucleic acid test. On the 13th of June, she developed symptoms, and based on her epidemiological survey and the other relevant clinical test results, she's confirmed case and a mild case. Number 13, male, 43 years old. She He works for the Xinfadi market and he lives in Huaxiang in Fengtai District. In the sampling and testing, he has been tested positive in the nucleic acid test. Based on the epidemiological survey and other clinical test results, he's been diagnosed with a confirmed case classified as a general case. Number 14, male, 28 years old from Hebei. He works for the Xinfadi wholesale market and lives in the Xinfadi workers' residence. On the 9th of June, he had symptoms like the sweating and also the runny noses. He's been tested positive in the nucleic acid test based on his epidemiological survey and other clinical test results. He has been diagnosed as a confirmed case, classified as a mild case. Number 15, male, 54 years old from Hebei. He works in Xinfadi wholesale market and he lives in the Xinfadi workers' residence. In the sampling and the testing, he has been tested positive for the nucleic acid test. Combined with his epidemiological test and other clinical test results, he's been diagnosed as a confirmed case and classified as a mild case. Number 16, male, 31 years old from Hebei. He works for the Xinfadi wholesale market and he lives in the Xinfadi workers' residence. In the testing and sampling, he's been tested positive in the nucleic acid test. Combined with his epidemiological test and survey and other clinical tests, has been diagnosed as a confirmed case, classified as a general case. Number 17, male, 52 years old from Henan. He lives in Beijing District, Xihongmen County. He has visited twice the Xinfadi market for shopping, and on the 12th of June, he had a fever and went to the fever clinic in the district. He's been tested positive. According to his epidemiological survey and other clinical test results, he's been diagnosed as a confirmed case and classified as a general case. Number 18, male, 61 years old from Henan. He lives in Guanyinsi Street of Fengtai District. On the 3rd of June, he went for shopping in the Xinfadi market, and on the 10th of June, he developed a symptom like the burning throat. He's been tested positive for the nucleic acid test. Based on the epidemiological survey and other clinical test results, he's been diagnosed as a general confirmed COVID-19 case. Number 19, female. She works for the Xinfadi wholesale market. She lived in Fangyang Street. In the sampling and the testing, she's tested positive for nucleic acid test. Combined with her epidemiological survey and other clinical test results, she's been diagnosed with a confirmed case classified as a mild case. Number 20, female, 54 years old from Anhui. She works for Haidian market of Yuquandong. She lived in the Fengtai District. In the nucleic acid test for workers in the wholesale market, she's been tested positive, and combined with the other diagnosed proofs, she's been diagnosed as a confirmed case and classified as a general case. Number 21, female, 51 years old from Hubei. She works for Haidian Yuquandong market and she lived in Shijingshan district. 2 meters from her stand, there were 2 other stands importing goods from the Xinfadi market, and she later developed symptoms. In the test, she's been tested positive for the nucleic acid test based on her epidemiological survey results and the other clinical test results. She's been diagnosed as a confirmed case, classified as a normal case. Number 22, male from Hebei. He works for Xinfadi market and he lives in the Xinfadi workers' residence. In the testing, he's been tested positive for the nucleic acid test based on his epidemiological survey and the other clinical test results, has been diagnosed as a confirmed case for COVID-19, classified as a mild case. Number 23, female, 62 years old, from Zhejiang. She works for the Xinfadi wholesale market and she lives in the Xinfadi workers' residence. In the sourcing test, she's been tested positive for the nucleic acid test. Based on her epidemiological survey and the other clinical test results, she's been diagnosed as a COVID-19 confirmed case, classified as a general case. Number 24, male, 58 years old, from Heilongjiang province. He works for the Meat and Food Comprehensive Studies Institute. He lives in Fengtai District. On the 12th of June, he developed some abnormality symptoms in the throat. He's been tested positive in the nucleic acid test. Based on his epidemiological survey and other clinical test results, he's been confirmed as a COVID-19 case, classified as a mild case. Number 25, a female case from Hebei. She lived in Fengtai District. She's a close contact with the confirmed case. She's been tested positive in the test, and combined with her epidemiological survey and other clinical tests, she's been diagnosed as COVID-19 patient, but a mild case. Number 26, male, 47 years old, from Liaoning. He lives in Xihoumen in Daxing District. He's also a close contact of the confirmed case from the 13th of June. He and the confirmed case visited the Xinfadi market, and later this case has developed uncomfortable symptoms, and later he's been tested positive in the nucleic acid test. Based on his epidemiological survey and other clinical test results, he's been diagnosed as a mild COVID-19 case. Number 27, male. He lives in Dahongmen Street in Fengtai District. He's been shopping in the wholesale market on the 13th of June. He visited the clinical fever clinic in the hospital, and later he developed the coughs and other symptoms. Based on his epidemiological survey and clinical test results, he's been confirmed as a COVID-19 case, classified as a general case. All those confirmed cases are all transferred to the designated hospitals for the treatment. According to our epidemiological surveys, the existing cases, confirmed cases, are all relevant to the Xinfadi wholesale market. So for all the residents in Beijing, if you have visited Xinfadi market in the recent days, please keep social distancing and keep your distance from the others, and inform the local authorities and go for a test. And please keep a close eye on your status of health. If you have developed any symptoms, please go to the nearest hospitals for a further examination. And when you visit the hospital, please wear a mask and avoid a public transportation. That is all for my briefing. Thank you, Madam Pang, for your briefing. And now I'd like to give the floor to Mr. Xu Ying from the Organization Department of Beijing Municipal Party Committee about the measures adopted at the level of residential communities. Friends of the media, good afternoon. In recent days, we have discovered quite a few COVID-19 confirmed cases in the city. In order to strengthen our science-based control measures, we have entered into a wartime-like status. For more than 1,000 communities in the city, we have mobilized the workers at the municipal level to strengthen our control measures and keep a close eye on the development of the control measures at the community so that we could curb the spread of the COVID-19 and the virus. We will try our best to cut off the spread of the virus and safeguard people's health and security. In recent days, we have taken the following measures. First of all, For the key populations and key areas, we have continued with the control measures and the screening. First of all, for the wholesale market of Xinfadi, for more than 8,000 workers and vendors and other relevant personnel inside the Xinfadi market, they have all completed a nucleic acid test by 0 o'clock the 14th of June. They have been transferred to the relevant institutions for the centralized quarantine and medical observations. We have also set up specialized work team to guide the observation and management of the observation spots. We are also following up with the service guarantee so that those people under medical observation could also enjoy a favorable environment. Secondly, for the nearby areas of the Xinfadi market, including 11 communities as well as 10 communities around the Yuquandong market, they have applied the lockdown measures. For 19,000 residents inside those communities, we are doing a nucleic acid test. For Fengtai and Haidian District, we have mobilized the government workers, as many as 1,690 personnel to go to work with the community workers in order to better arrange our work. The volunteers will deliver the food and also buy the life necessities for the residents inside the lockdown communities. And we also offer psychological help. Currently, the life is going on in a normal way. Next, for the communities, we have organized the door-knocking activities. That means we will visit people at their doorstep, or we will call them or contact with them with the WeChat and other apps. For those people that have visited wholesale market of Xinfadi, since the 30th of May, there were 200,000. And now on the basis of the community, we are organizing the nucleic acid test and also the at-home quarantine. Number 4, for those communities that have discovered confirmed cases, we will apply the lockdown measures. We have elaborated 12 articles for the management. For example, for the vehicles and non-residents, they are forbidden to enter into the areas, and we have closed down non-essential workplaces and public places. It is forbidden for people to organize a big gathering. And we have also carried out the sampling measures of the environment for the business environment, shopping areas, construction fields. We have also strengthened our management measures. And secondly, for the community level measures will be strengthened. For the communities, we will adopt the third level response mechanism and also the level 1 status of work. We have people 24 o'clock a day on duty, and they will strengthen the disinfection of the total environment of the community. We have suspended all the recreation-related workplaces and public places. Residents will have to show their residential cards in order to enter the communities. For the vehicles, they will also be closely followed. People have to get themselves registered with the information system. For the home services and delivery persons, as well as other non-residents to the communities, they have to get themselves registered and show the health code of the community before entering into the community. Communities will also have the posters in place to give people more information and share the guidelines with the residents so that they can better cooperate with the community. Thirdly, we will bring into full play the role of the party committee in order to support the grassroots level of prevention and control. Government workers will grassroots level community prevention campaigns. Today, they are all in post for the Xinfadi market and Yuquandong Market, nearby communities, especially those that have discovered confirmed cases, they will be receiving a centralized effort. While doing all those above-mentioned efforts, we will continue to play a leading role. For the grassroots party members, they will play a pioneering role in collaborating with the local community workers and volunteers. At the same time, we also require the collaboration from the massive residents, so that together we can form a front line against the COVID-19. I'd like to thank everyone for their collaboration. Moving forward, we will continue to apply the accountability system and be very careful and strict in the application of the measures. For example, with the centralized quarantine and home-based quarantine, we will continue to keep a close eye on the nucleic acid test results and follow all the procedures to take care of the patients. The community will continue to play an important role in the prevention and control of the epidemic, and they will never step back. Community-based prevention and control is closely connected with the safety and health of everyone. We hope that the residents will continue to show us support and collaboration. And I also would like to invite them to pay more attention to their personal health and take protective measures. Once again, a notice for the residents. For those that have visited the wholesale market of Xinfadi since the 30th of May, or those who have close contact with the workers in the Xinfadi wholesale market, for the sake of the health of your family members and yourself, please inform the local authorities about your trajectory and go for a test. You have also followed a 14-day of home-based quarantine with your family members, and you have to wear a mask even though you are in a home-based quarantine. You have to eat separately with your family members and avoid the contact with your family members. If you feel any uncomfortable symptoms, please call 120. Please try to discover the symptoms earlier and call the authorities earlier. Please have the confidence in the community. We have accumulated a lot of experience over the past period. We have the capacity to safeguard our capital city, and we can protect all of you. That is all for my briefing. Thank you for Mr. Xu Ying. Now I'd like to give the floor to Mr. Wang Hongchun, Level 2 Councillor of Beijing Trade Bureaus, to talk about the measures to secure the market supply and the price stabilities. Friends of the media, good afternoon. Now I'd like to talk about the price stability and supply measures. After the shutdown of the Xinfadi wholesale market, according to the decisions of the municipal authorities and relevant associations, we have taken the massive measures to guarantee the daily supply of life necessities for the people. First of all, for the supply of vegetables is in the rise. Because we have temporarily closed down the Xinfadi wholesale market, we have expanded the temporary transaction areas. And this has enabled us to increase the capacity of transaction and the supply of the vegetables. Currently, we have 1,800 tons transactions made in the temporary areas. We have 294 vehicles for the transportation of the vehicles. Second, for the market supply volume of the vegetables, it's rising up. The other markets, for example, Dayanglu, Yegezhuang, are taking over the supply function of the Xinfadi market. So we have maintained a daily basis increase of the supply. For example, we have a 36.6% of day-to-day increase of a certain market compared to yesterday. Number 3, for the supermarkets and other retail markets have expanded the dispatching volume of vegetables. Yesterday, we have a volume of 2,100 tons, and today we have added another 2,500 tons. Jinkelong Supermarket has purchased twice the level of the usual amount of purchasing, and the other supermarkets have also increased their purchasing by 120 tons, or 5 times the normal level. For all the other supermarkets, they have increased the imports of the vegetables so that they can stabilize the price. For the stabilization of the markets, we have the collaboration mechanism. For example, the large wholesale markets are in collaboration with the supermarkets and other retail markets. We have selected 7 level 1 wholesale markets and more than 400 large vendors. They are in collaboration with the level 2 markets and the retail markets so that they can have the obstacle-free channels for the transactions of the vegetables. Second, for the catering sector, we have collected the information about their urgent need so that we can guarantee the daily supply of the vegetables to the catering sectors and also the canteens in the work units. Today, for the level 1 wholesale market, they have also the favorable environment to have the direct contact with the catering sector. Number 3, we have a smart system in place to have a quick fill-up mechanism. If we find that there's the shortage of vegetable for certain spots of the network, then immediately we have the information flow inside the network and we can fill up on the shortage as soon as possible. Even with a shortage problem outside the network, we can have the inter-network distribution. Number 4, by midnight yesterday, we have launched another initiative to encourage the retailers to stabilize the prices and the supply, and also to guarantee the safety of the food. We ask them to assume their responsibility to stabilize the market and also guarantee the quality and safety of the food. We also ask them to respect the morals of their work and ask them to guarantee the supply. For example, Shouhang and 20 more other supermarkets have joined our initiative. Number 5, we have mobilized the temporary government-side supplies. For example, we have dispatched the other provinces reserved from the market, reserved from the government to serve the market in Beijing. Those are the measures to guarantee the supply of the market and stabilize the price. Thank you for your briefing, Mr. Wang. And now the floor is open for your question. Please first identify yourself before raising a question.
你好，北京日报社记者，这个问题想提给庞主任。请问庞主任，近几日有些没去过新发地市场
I'm from
但有
Beijing
疑虑的居
Daily.
民，
I
也
have a
想到医
question
院的
for
发热
Madam
门诊进
Pang.
行筛查，
In
他们该具
recent
体怎么
days,
办呢？谢谢。
some persons that have not visited Xinfadi market but have doubt about their health condition, could they go for a test? According to the statistics features of the Xinfadi confirmed cases, currently we ask all the people that have visited the Xinfadi wholesale market or have a close contact with the workers in the Xinfadi wholesale market since the 30th of May. They should report this to the local authorities and go for a nucleic acid test and start their home-based quarantine. If they have the coughs or the fever, they should report it to their community and to the work units and go to the nearest hospital for treatment. For those other people that have no contact with the people working in the Xinfadi market and have zero symptom until now, it is recommended that they do not go to the hospitals. They can continue to keep a close eye on their health status. If they have the diarrhea, coughs, and the burning throat, then they could first get some protective measures and then visit the hospitals. For people that have not visited the Xinfadi market in the recent period, if you are still interested in the nucleic acid test, you could make an appointment with a certain test laboratories. You could refer to the Beijing Health Commission for more information. That is all for the QA session. The press conference of the COVID-19 response is organized by the Information Office of Beijing Municipality. You could also catch up with us with the radio, with the newspaper, with the TV, and other news terminals. For example, the Xinhuanet, CCTV News, CCTV Financial News. We have the online live stream programs. We also have the Beijing TV, Beijing Transportation Radio, Beijing Television, news channels,